What about others? Okay, we have people from Myanmar. Swamong from Numkone. Okay, welcome, sir. If anyone's comfortable unmuting themselves and introducing, that's fine too. Okay, we have people from ISC Myanmar. That's great. It's good to see you all coming from different parts of the country. Sorry, from different parts of the world. Okay, then maybe we can start. Elsie ma'am, can we start?
Yes, please go ahead.
Okay, ma'am. I'd like you to share the screen, the PowerPoint presentation. Okay, welcome everyone to the breakout room discussion for people from Bhutan, China, DPRK, Maldives, Mongolia, Nepal, and Sri Lanka. I'm sorry, I'd like the first slide. Okay, thank you. So I'd be moderating. I'm Bhumika Gupta. I'm from India. I'm a member of PWG STEPS. It's a policy working group stepping towards enhancing policy structures, and it is anchored by the Youth Parliament Foundation India. Along with me, I have a fellow moderator, Maziko ma'am. Would you like to introduce yourself?
Sure. Thanks, Bhavika. My name is Mazhar. But I'm a focal point person. Yeah, please feel free. Oh, sorry. Sorry, so I'll just say that again. I'm a Matambu in Malawi. I'm the focal point person for Malawi in the AYC. I'm the vice president of the Young Communities Network. I'm super excited to be here with everybody. Please feel free. There's a chat box and let us have some fun.
Okay, and we have, thank you for your introduction. We have a co-facilitator, Elsie Aquara ma'am from WHO. Ma'am, would you like to introduce yourself? Elsie ma'am, are you there?
Sorry, I was unmuted. Can you hear me?
Okay. Yes, ma'am, you're audible now.
Okay, perfect. So as I was saying earlier, my name is Dr. Elsie Aquara. I work with WHO. I've been working in ASRHR for about the last 10 years, and I'm quite excited to see this launch and being led by the youth moderators. Over to you, Bamuka.
Thank Thank you, ma'am, for your introduction. We'll be having this breakout discussion. I would be focusing on two chapters. First is chapter 3, which is meaningful participation, and the second chapter is chapter 7, which is data for action. I'd like to ask two questions from all of you, and please feel free to use the chat box for answering. And if you'd like to unmute yourself, you can raise your hand, and we'd surely want to hear from you. Looking forward to your active participation. So the first question is, what do you think are the problems adolescents have been facing with regards to SRH in pre-COVID and then during the pandemic times? I can also type it in the chat box. Yeah, I can repeat. Saying that we'd be focusing the discussion on two chapters, chapter 3, which is meaningful participation, and chapter 7, which is data for action. I'd like you to answer this question. I've put that in the chat box too. What do you think are the problems adolescents have been facing with regards to SRH in pre-COVID and then during the pandemic? Please use the chat box, or if you want to unmute yourself, you can please raise your hand. We'd be more than happy to hear from you. Okay, so Shanu just says access to SRH services. Okay, what about others? Okay, Divya says access to health services, education, increased risk in terms of child marriage, teenage pregnancies. Exactly, ma'am. Can we hear from others too? Is there anyone who'd like to share an experience or something that that person witnessed personally? Something like that? Domestic violence, yes. Okay, Francisca says access to health services. If you guys have any experience or something that you've witnessed, you can also talk about that. Okay, Shani just says forced marriages, unintended pregnancies, gender based violence, intimate partner violence, and early union. Yes, ma'am. I do agree with all of you. So we have a good audience, an interactive one. Okay, Nain says delay access to SRH and SGBV. Okay, we have another comment access to have justice for violence, especially gender based violence. Yes, exactly. What about others? Is there any incident or any experience that you'd like to share with all of us? We'd be more than happy to hear from all of you. Okay, I'd wait for 30 seconds if there's anything else that you want to share. Okay, so thank you for your answers. They were really providing an insight to many problems and issues that adolescents faced. And yes, that's true. Okay, we have another comment. It's access to have health services and separate facilities in the quarantine center during the pandemic. Yes, exactly. Okay, so we've had wonderful answers and they were really good. I guess we can maybe move on to the next question. So, my next question for all of you is that how would you, as an individual or as part of any organization, be using this toolkit? I'm writing this in the chat box too. 1 second. how would you, as an individual or as part of any organization, be using this toolkit? Can we hear from you? Okay, Divya, you can go on.
Bamaka,
Yeah.
we also
Hi, Bhumika. Hello. Can you
Hi,
hear
yeah,
me?
you're
Hello.
audible. Go on.
Yeah. Thank you. Thank you,
Thank
Bhumika,
you.
and hello everybody in the group. The I am from Population Foundation of India, Rajasthan, India, and the toolkit how we would be using is like we already have reach out to around 3,000 to 4,000 adolescent boys and girls where we are focusing a lot of issues related to reproductive sexual health, teenage pregnancy, child marriages, getting them back to school. So I guess this would facilitate us to revisit our toolkit and kind of do a midway course correction of whatever is happening onto the field, because this is very informative and helpful to us. Thank you.
Thank you, Divya ma'am, for your answer. I'm more than happy that you'll be able to use this toolkit. And the work that you're doing is definitely appreciable. Thank you for putting efforts and answering my answer. Thank you for your answer. Can we hear from others too? Do you still want to say something, ma'am? You've raised your hand, or is it by mistake?
Bamika, I
Divya
think
ma'am?
that was an earlier hand raise
Okay,
from Divya, if I'm
okay,
not
ma'am.
mistaken.
So maybe we can hear from the other participants too. Please feel free to use the chat box if you're not comfortable uh, unmuting yourselves. I'd give you, I'll wait for a minute if anyone wants to say something or put forward any ideas. It's just that how would you, as an individual or as part of any organization, be using this toolkit? How would this toolkit be beneficial for all of you? Okay, waiting for 30 seconds more. You can use it. Okay, we have an answer, I guess. Okay, then let's move forward. So now I'd request, ma'am, can you share the second screen, please? The second slide, I mean. Yeah, thank you. Now I'd request my fellow moderator, Maziko ma'am, to take over the floor and to have discussion on the chapter 3, meaningful participation. Thank you. Over to you.
Hi everyone, I'm not sure if you can see me. I can't see myself.
No, you're not visible.
I'm really not sure what's going on with my camera, but I think perhaps we could just start. So hi everybody, like I introduced earlier, my name is Maziko Matemvu, and I will be taking you through this chapter, which is for meaningful youth. Meaningful participation. And I'm not actually able to see the screen, but this chapter pretty much focuses on meaningfully engaging adolescents and youth in programming that benefits them. It also is important to engage community members in ASRH activities. So the chapter has three main components. I am so sorry about the bird. I know, I know this is crazy, but it's literally out here. Can't chase it, but hopefully you can hear me. So the chapter has three main components, so which is for adolescent participation, community participation and participation tools. Before I get started, I really just wanted to hear from everybody. Do you think that meaningful participation is important? Let's just hear from everybody. Do we think it's important? Yes or no? So if you could just type in the chat box if you think meaningful participation of adolescents and young people is important, just please um, type in the chat box before we get this discussion going.
Also, just to keep in, to be cognizant, we do have a limited time. We have about 20 minutes now left, and we still have to cover chapter 7. So,
Okay.
yeah, if you can just comment or even have a comment in the chat box or just unmute yourself and speak, that'll be useful.
Okay, great. So I can see people responding that yes, we do need meaningful participation. We do need meaningful participation of adolescents and young people in ASRH programming. Now, how do you think you and your organization will make sure that you're including young people who live in hard to reach areas, right? Because we're talking about ASRH programming and reaching different kind of adolescents and young people. So how will you reach out to adolescents and young people who live in hard to reach areas? I would really love to hear from you. Thank you for all the feedback. I think we agree that it is very important. So I'm asking, how do you think that you will involve young people who live in hard to reach areas? How will you meaningfully engage them? I'll just try to type the question in chat box as well. Anyone who may have missed that. All right, socially, but you say yes, it is important and patient for adolescents community or both. Questions to participants. Yes.
Hi, Maziko.
Sorry, Dr. L.
Yes, go ahead.
Hi, sorry, could you please read? Has there been any comment? I lost connection.
Yes, I realize that, and I think you're trying to reiterate my question to the participants. So, recall that you asked before if meaningful engagement is important, and we had many respondents responding yes. So the question to the participants is, are you referring to the adolescent participation, community participation, or a combination of both?
That will have to be a combination of both. I'm not sure if that's more clear now. All
Yes,
right,
it's
so we
clear.
have,
Yeah, go ahead. Over to
okay,
you.
great. We have a response from Divya who says community members work as gatekeepers. So if we're looking at a holistic development, we need to look at an approach where we meaningfully engage with both. That is great, but how are we going to ensure that we're meaningfully engaging with both? What intentional participatory model approaches will we be incorporating to ensure that we are meaningfully engaging community gatekeepers, but also adolescents as well? Right, guys, let's chat. Use the chat box. I'd love to hear from you.
Okay, participants, it will also be useful if you can give examples from your country, and also given the COVID situation, it's very timely that this toolkit came out. So we have disruption of services. So in terms of examples of how to engage in a meaningful way, adolescents and also the community, what have your country done? And also how what are innovative way that you can be able to engage that your organization has done? We have 15 minutes remaining. So perhaps we can just do like 5 more minutes and then we move on to chapter 7.
Okay.
Oops.
So, does anyone have any experiences that they would love to share? Practical examples on how to meaningfully engage adolescents. All right, so we have a comment from me. Sorry, I'm not sure if I'm pronouncing that correctly, but he or she says that we can engage with the adolescent for doing the community development to see the change. And I think that's a very important point, because if we're talking about meaningful participation, then decisions affecting different people, the people who will be affected by certain decisions, need to be part of the decision-making process, the programming, the designing of the project, and also the monitoring and evaluation of the project. So I think because we're running out of time, I'm just going to quickly move to the next question. But we also have a comment from Tin. I'm so sorry if I'm mispronouncing your name, but you say that during COVID period, online awareness sessions through peer educators. And I really like the diversity of your response, because you're talking about online awareness for young people who have access to the internet, but then we could also use the peer educators, for example, in communities, but then also through online awareness to kind of get insights from young people. And we have a comment from Rohita, who says adolescent participation at all levels, from policy to community level, meaning equal representation of adolescents in communities. And that is very important, which brings me to my next question. How do we meaningfully involve young people beyond tokenism? We have 2 minutes left. So if we could just get a response, how do we involve young people beyond tokenism? Because what we usually experience as young people is that they just want to invite us to certain meetings, to be part of certain frameworks, but we're not being meaningfully involved or engaged. They just want to tick a box that a young person was here, the young person was present in this room, but how do we meaningfully engage young people beyond tokenism? And I think that Rohita also brings, her response also fits into that question, because she says, or he, that adolescent participation at all levels, ensuring that adolescents are present in all decision-making bodies and tables. So if we could just we're running out of time. I think we've 1 minute left before we go to chapter 7. But if you know how we can engage young people beyond tokenism, please use the chat box. Dr. Elsie says she agrees, and we can also engage the adolescents who are already leaders in their communities. Online engagement is also important. And our last comment, peer educators need to ensure that adolescent participation, that there is adolescent participation and awareness on social media would be great too. Before I pass this over to Bhamika, I just wanted to say thank you very much for your interactions. And what is very important is, if we are aware that young people are being used as tokenism, let us use our voices, our powers and our authorities to ensure that young people and adolescents are meaningfully engaging. Over to you, Bhamika.
Thank you, Mosaico, for the wonderful discussion. Okay, so now let's talk about chapter 7, which is data for action. This chapter is new. It was not there in the 2012 toolkit, and it explains how any staff, including SRH managers, they can use the data to improve their programming and include adolescents in all their data for action activities. So this chapter has four main components, which is conducting assessments, which details the many different kinds of assessments which are there and how they can be used in various humanitarian responses. The second which outlines the steps for taking for designing an ASRH project or integrate ASRH activities into the health programming which already exists. The third component is implementation and monitoring, which describes the importance of monitoring and reviewing data and how to overcome the common barriers in accessing the ASRH. The fourth component is evaluation and documentation. It explains how to think about evaluation and documentation from the beginning of a project design and not just using it in the end or in between, but using it throughout the process. So this chapter is indeed a very important chapter. So the questions that I'd like to ask from all of you is that how would you or your organization be using the guidance and tools from this chapter? I'm writing this down in the chat box. Okay. Can we hear from you, please? If you're comfortable unmuting yourselves, you can do that, or else you can use the chat box too. So the question says, how would you or your organization be using the guidance and tools which have been provided in Chapter 7, which is Data for Action? I did not deeply go through the chapter, but I just covered the main points and the basic four components just in order to provide an insight. But how would you how would you or your organization be using the guidance and tools from this chapter?
And also, just to add on top of what Bamika said, because we're running a little bit short on time, what we don't really have data on is very young adolescents, especially those between 10 to 14 years old. And these are very formative stages to collect crucial data, and also data on domestic violence, as we had a couple of participants commenting when we were discussing chapter 3, as well as menstrual hygiene, and domestic violence. And then, given that this is a toolkit for humanitarian settings, we also do not have data on culturally sensitive information. So, given the question that Bamuka just posed, how can your organization or what you've learned or given reading this chapter 7, what can we do to make sure that data is more available? Over.
Everyone please feel free to use the chat box, or if you want to unmute yourself, you can please raise your hand. Would love to hear from you. Any views, opinions, anything that you'd like to share? We have 13 participants. Anyone can sort of volunteer to say something. Okay. So we have a response. We can collect SRHR data using assessment form for service need assessment. Okay. Thank you, sir, for your response. Yes, we can definitely do this, and it'll really be helpful. Any other comments or anything else from the other participants? Okay, waiting for a minute. No worries, ma'am. I was asking that my question to you was how would you or your organization be using the tools or guidance which has been provided in this chapter 7? Okay, we have another comment. We are doing program design, implementation and monitoring, and evaluation and documentation. Okay, so that looks great. Waiting for another 30 seconds, or we can move over to the next question. Um, Okay, we have another comment from Rohita. One second. Disaggregated data, not only gender wise, but also data from people living with disability. Okay. Will provide the specific needs which will guide in planning of programs as per their need. Yes, exactly. We should cover people with disability too. I guess I missed on the last comment. I'm not able to see it. Just a second. Okay, then maybe we can move on to the next question because we have only 5 minutes remaining. Okay, so my next question to all of you, one second please, is that how can you, your agency, help in providing evidence for things that are working and the barriers in ASRH during emergencies? Can we have any comments on this, please? How would you, as an individual, or your agency would be helpful in providing evidence for things that are working and the barriers in ASRH during emergencies? If you feel comfortable, you can unmute yourselves, or else it'll be helpful if you use the chat box. Guys, we have only 4 minutes pending. Can we have any comments on this? Anything, them like not able to see anything in the chat box. Feel free to use the chat box, or else you can raise your hand. And you can unmute yourself.
Oops. All right, Bamuka, while we're waiting for responses and in the looking at we're running out of time. So what at least we have identified in this area for data for action, as we were discussing in the other previous question, is that we do not have data for young people and it's difficult to collect domestic violence data. We have cultural differences in humanitarian settings because you can have refugees coming from different countries. So that is one of the barriers. And then the benefit is to collect this information from adolescents who are already key people. I see a comment. Yes, and unable to access SRH during emergencies. So needing to have mobile SRH services, that could be one of the benefits, to have mobile SRH services and to go to where the most vulnerable are. And then given the fact that adolescents are a heterogeneous group and their evolving capacity, we can be able to sort of attend to their needs as effective as possible, given I see a lot of people are coming from UNFPA. So UNFPA works a lot with reproductive health. So they can come with their expertise and using this toolkit to be able to access them effectively. Over to you, Bamuka.
Yes, ma'am, definitely. You showed like the all the main points that came out of this discussion. We had one of the participants who had raised their hand. Rohit, I've asked you to unmute yourself. If you wanted to say something, you can go over. We have just 2 minutes left. So
Hi, Bhumika. I was just actually typing in regarding your question on how we can help in providing evidence. One of the interventions that we did during COVID in Nepal was, doing radio programs for adolescents to promote ASRH and comprehensive sexuality education. So one of the evidence, one of the mm, one of the key point that I would like to highlight here was we did this baseline and an inline quick study on the radio program, so that we could compare what was the situation before and after the radio program. So I just wanted to share that one, Bhumika. Thanks.
Thank you, ma'am. You've been doing wonderful work. And yes, that was indeed helpful. Thank you for sharing that. Is there anything that anyone else like to say? Okay, we have another comment. We're supporting very basic thing like sanitary pad and sharing information about GBV services. Okay. Thank you, everyone. Thank you for joining this breakout discussion. You all are wonderful participants and a wonderful audience. Thank you for providing your insights. We'll now be moving on to the main room. Thank you.